to another episode of Vitals and Voices, where we bring clarity to the complexities of the American healthcare system. One story, one solution, one voice at a time. My name is Dr. Felucio Ogufitimi, and today's episode is a little different because I'm reaching out to you from Chicago, where we just wrapped up a meeting at the American Medical Association Relative Value Service Update Committee meeting, otherwise referred to as the RUC. And I'm here as a representative of the AAPA, and I want to try and take you inside a part of healthcare that most clinicians know exists, but very few truly understand. Because behind every CPT code, behind every RVU, behind every reimbursement decision, there's actually a conversation happening, and that conversation helps shape how healthcare is valued and ultimately how it's delivered. So I'm hoping to kind of share some insights with you along those lines. Most clinicians are very familiar with RVUs, right? They understand productivity, they understand compensation, they understand the pressures tied towards seeing more patient and volume. But very few actually stop to ask who decides what a service is worth. And that's where the RUC comes in. The AMA RUC serves as an advisory body that makes recommendations to CMS on the relative value of physician services. And while that may seem very technical, the implications are anything but, because when you assign value to a service, you are, in many ways assigning a value to a type of care that you are delivering. So being at the RUC meeting, being here in person, what stands out to me immediately is that, the discussions are extremely robust. They're analytical and deeply collaborative. There's a level of rigor in evaluating things like practice expense, clinical labor inputs, equipment costs, time and intensity of services. And what's striking is not just the data, but the intentionality behind the conversations. Participants understand that these decisions don't exist in a vacuum. They have a ripple effect into things like physician provider compensation, practice sustainability, patient access, healthcare system strategy, and increasingly they're asking a new question on top of that. And that question is, how does artificial intelligence AI change all of this? How does it impact all of this? One of the most important undercurrents in the discussions this week that continues to grow is this knowledge and awareness of AI, not just as a concept, but as a force that is already reshaping how we do clinical documentation, how clinical decisions are made, and the support along those lines, workforce efficiency, time allocation. And that creates a fundamental tension because the current valuation system is built on time, effort, and intensity. But what happens when AI changes all three of those? What happens when documentation time is reduced because of AI, or clinical workflows are streamlined because of AI, or decision making is augmented? Does the value of the service change? Or does the system need to rethink how value is defined? At its core, the RUC process sits at the intersection of several long lasting, enduring tensions. Is it procedural versus cognitive care? Is it time versus intensity? Specialty economics versus primary care sustainability? Fee for service versus value based care? And now, layered on top of that, technology versus traditional valuation models. These are not simple debates. These are nuanced. They are data driven and they are deeply, deeply consequential. Now, from my perspective, and from the lens of advanced practice providers, there's an additional layer that we need to at least identify and communicate around. We talk often about team-based care. We talk about optimizing the workforce. And we talk about improving patient access. But our valuation systems still largely operate through a um, solely physician-centric framework that and in my mind, that creates a little bit of a disconnect. Because if we're serious about expanding access, improving efficiency, building sustainable care models, then we have to ask ourselves, are we fully capturing the value of the entire care team? Are we still measuring a modern system, with legacy tools? What's clear from being here this past weekend is that the participants in this process are not unaware of these challenges. In fact, quite the opposite. There's a genuine recognition that healthcare is evolving and that valuation must evolve with it. The question is not whether change is coming. I think we can all agree with that change is coming. The question is how quickly can systems designed for a different era adapt to a new reality? So as I reflect on this experience, one thought continues to resonate with me, and that is what gets measured gets paid, and what gets paid gets prioritized. If we want to transform healthcare, we have to be willing to transform how we define value, how we define the value of a service. So, this is just the beginning of the conversation. In future episodes, I'm looking to bring in more voices from within this space to do a deeper dive into this discussion of value and AI and transformation of healthcare system. But in the meantime, thanks for listening to another episode of Vitals and Voices, where we bring clarity to the complexities of the healthcare system, one voice at a time. I'm your host, Felicia Ogunfiditini, and have a great